Sole ulcer and white line disease, toe necrosis, and heel erosion in cattle. So, for sole ulcers, they happen in intensive farmings, especially in dairy and fattening bulls, and especially in the winter. The most affected part is the hind limb and the lateral claw, especially at the caudal end. The causes, it's often secondary to laminitis, and it's due to trauma or weakened or injured sole. And then bacteria can form from the environment and it causes ulceration and abscesses. For the clinical signs, we can see hind limb lameness and blood on the floor. And for the treatment, have hoof trimming and have no chemical intervention as it heals faster. And then block the healthy part of the hoof to relieve pressure off the sore part. But you often have to cull the cattle because of a sunken P3. In the case of white line disease, it's secondary to laminitis. It often affects the hind limb, the lateral claw, the abaxial side, and near the heel bulb. For the pathogenesis, laminitis leads to detachment of the hoof wall and the corium. And then this can cause a white line hemorrhage. And then the white line widens. And then this can cause white line separation. For the clinical signs, if it's bilateral, they can usually compensate for a long time. But if it's unilateral, there'll be visible lameness. And we can often see discoloration of the white line, including pus and blood. The consequence of this is proximal spreading, and pus can get through the abaxial wall, which leads to local swelling. And if it spreads to the bursa of the deep digital flexor tendon, it can cause a rupture or an abscess. And for the treatment, trim until healthy, until you can see visible healthy tissue. If there's white pus, it might be mild, and if it's black or brown, it means there's bacteria. It usually ends in culling. Toe necrosis, also known as toe tip necrosis. The causes are the P3 sinking due to laminitis. Blood vessel damage causes an increase of pressure, which causes the toe to have necrosis. It can then spread to the joint. If they also have pain in their heel, they'll compensate by leaning more on their toe, which causes pressure on the toe, which can lead to toe necrosis. And it can also happen during transport. If they're standing for a very long time, they can get hyperemia, which causes blood vessel damage, which can lead to bleeding and toe necrosis. Blood vessels are the arteria digitalis palmaris and plantaris. For the clinical signs, we can see bleeding and lameness, and visible necrosis on the toe. For the treatment, you only treat in uncomplicated cases. This includes opening and cleaning and using tetracycline spray. You can also have a digital amputation and sealing with a plexiglass, or using systemic antibiotics. And for heel erosion, it happens in dairy cows, especially in wet contaminated bedding, and it's more common in the winter. The cause is unknown, but it's often associated with laminitis. For the pathogenesis, erosion occurs on the heel, and this leads to pain, and it can often lead to abnormal weight distribution, which leads to a heel horn thickening. And this can cause sole ulcers. For the treatment, have hoof trimming and weekly foot baths and good hygiene.